Namaste and a good day to you. I'm your helpful Indian. A warm welcome to you on this channel. Firstly, I thank you very much for choosing to watch this video even though it is quite long. Please allow me to begin by asking you, does your face suddenly start looking like this, or do you suddenly have a drooping of your face, or do you also additionally have a one-sided weakness or paralysis of the muscles of one arm and of one leg or of one leg? I mean, is there a weakness or paralysis of arm and leg or arm or leg? I hope you understand. Can you additionally not speak clearly suddenly, or does your tongue suddenly feel like it is now numb or paralyzed? Or does someone you know have these problems suddenly? If yes, then I request you to please call an ambulance immediately, or please get to a hospital immediately, or please take the person with these issues to a hospital immediately. If these symptoms are present in that person, then it is very likely that the affected person is having a stroke, or that person is having a stroke. But if you as a viewer have none of these symptoms, and if you would like to know more about this issue, which is stroke, then please watch this video till the end if possible. In this video, I want to try and provide a lot of necessary details. I want to cover important details or facts step by step. And in this video, there are maybe some spelling mistakes which I couldn't correct. But if you are able to ignore these few errors, and if you are able to watch this video till the end, then this video and the information it contains will surely be helpful to you now or in the future. That is why I request you for a little patience. Uh, Hopefully, I can explain everything thoroughly in detail. Once again, I would like to state that this video is about stroke. A small note: in this video, I mention the American Heart Association as a source every now and then. Since the foundation of this association, about 100 years ago in the year 1924, they have played a tremendous role in the improvement of the status of the cardiovascular health of people and to reduce the chance of death due to cardiovascular diseases and strokes. Among the other courses that this association offers, ACLS and BLS are two courses, and these courses are offered to those people who treat people on an everyday basis or on an emergency basis medically. In India, every medico or every student of medicine has to complete at least the BLS course before receiving the medical degree. Okay, so what is a stroke? There are two types of stroke: an ischemic stroke or brain infarct, and hemorrhagic stroke or brain hemorrhage or brain bleed. In brain hemorrhage, there is a bleeding into the brain due to the rupture of an artery or an aneurysm in the brain. An aneurysm is an abnormal or pathological widening or ballooning of an artery, and due to the rupture of the artery or an aneurysm, there is a sudden explosive flow of blood into the brain tissue. As a result of that, the nerve cells are structurally damaged. This is why the brain function in that area immediately stops, or it is severely reduced. In the other case, or in an ischemic stroke or in a brain infarct, an infarct occurs in the brain. Due to the blockage of an artery which supplies blood to the brain or to some parts of the brain, there is an absence of oxygen and nutrients in that part of the brain. As a result of that, this part of the brain dies slowly due to the greatly reduced or absent supply of blood. Now, a part of the brain is dead or it is slowly dying, and because of that, the body parts do not function properly, which are normally controlled by this part of the brain. The following images serve as a visual or diagrammatic explanation of the development of brain infarct or of an ischemic stroke. Let's assume that this is the cavity or the lumen or the interior of a healthy artery, or let us assume that the cavity or lumen or the interior of a healthy artery looks like this. Over time, cholesterol and calcium and other minerals deposit on the inner wall of the artery. This results in the inflammation and further depositions occur in this area. The interior or the cavity of the artery slowly reduces in size. And this change or these changes are called atherosclerosis. Sometimes there is a free blood clot or a freed piece of fat or some other particle or object in the blood which blocks an artery, and this obstruction is mostly caused by a blood clot. This blockage is possible in those arteries that have already been narrowed due to atherosclerosis. Atherosclerosis can happen anywhere in the body, but when the artery supplying blood to the brain or to parts of the brain becomes blocked in this way, then there is an absence of oxygen and nutrients in the affected part of the brain. As a result of that, a brain infarct occurs. And atherosclerosis occurs among everyone, but it happens faster among people having the following conditions of high blood pressure, diabetes, elevated levels of fat or cholesterol in the blood, among smokers and among people who vape. Also, it happens faster, and among stressed people, it happens faster. And there are also some other risk factors for atherosclerosis. Depending on where the blood clot or the particle originates, which blocks an artery in the brain and causes a brain infarct, there are two types of stroke. A thrombotic stroke, in which the blood clot forms within an artery of the brain and blocks the same artery later on. And then there is the embolic stroke, where the obstruction originates somewhere else in the body and later blocks an artery in the brain. In this image, you can see the differences between the two types of stroke, between these two types of stroke, where the object of obstruction originates, what causes these infarcts, etc. I hope these details are visible. And as you already know, for every disease or illness, there are factors that trigger or worsen the disease. These factors are called risk factors. In the same way, a stroke occurs due to the following risk factors. It mostly occurs among the elderly people or among people who are over 60 years of age. It occurs when the person has high blood pressure or hypertension, or high blood pressure or hypertension is a risk factor. It is common among men than among women. Diabetes mellitus is a risk factor. A history of TIA or transient ischemic attack in the past is a risk factor. Among people with atrial fibrillation also it could happen. Hereditary or genetic conditions like amyloid angiopathies are also risk factors. A sedentary lifestyle in which the person moves very little and spends the entire day sitting is also a risk factor. Smoking is a huge risk factor. People who regularly take blood thinners and people who were recently treated with thrombolysis or through thrombolysis, or people who have a bleeding disorder or issues with clotting blood could have a brain hemorrhage. People who have recently undergone balloon angioplasty or angioplasty with stent implantation, and those people who have undergone the diagnostic procedures like angiography may have a brain infarct. Okay. A brain infarct may also occur among people who have sclerosis of the aortic valve or a calcified aortic valve. There are many more risk factors, but these are the most important ones. So, complaints. The symptoms usually are sudden numbness on one half of the body, or sudden numbness of one half of the body, or a partial or complete paralysis of one half of the body. By this, I mean that either the strength of the muscles of one half of the body is greatly reduced, or there is a complete loss of control of the muscles in that half of the body or on that half of the body. Sensations will either be reduced or they will be lost suddenly. Symptoms of confusion, slurred speech, or difficulty in understanding could develop suddenly. The affected person might suddenly have difficulties seeing properly. One or both eyes might be affected. Usually, both eyes are affected. The affected person might also suddenly have difficulty in walking and in maintaining balance. There might also be a sudden lack of coordination. Dizziness and problems such as memory lapses or memory loss might occur suddenly. Sudden headaches might also occur. And as you can see, all of these symptoms occur suddenly. But there are no rules that say that all of these symptoms have to be present in every person who has a stroke. In some people, there might be only confusion and no paralysis or weakness of muscles. And that could happen if the brain infarct or the brain bleed is small, or if they were smaller. Partial paralysis or weakness of one half of the body, which is called hemiparesis, could be a symptom. There could also be a partial weakness of all four extremities, which is called tetraparesis. There could also be a partial weakness of both legs, which is called paraparesis. Complete paralysis could also occur, in which one or more limbs become completely paralyzed. Complete paralysis of one half of the body or hemiplegia could be present, or complete paralysis of all four limbs or extremities, which is called tetraplegia or quadriplegia, could occur. Paraplegia or complete paralysis of both legs could also be a symptom. So that we would never forget the symptoms of some diseases, we have certain mnemonics. For stroke was fast, then mnemonic for the symptoms. F means facial drooping, A means arm weakness on one side of the body, S means slurred speech, T means time is critical. If these symptoms suddenly begin, one should either call an ambulance or go to a hospital immediately. And the longer the treatment is delayed, the more irreversibly the brain tissue dies, or the affected part of the brain dies. This is why neurologists say time is brain and time lost is brain lost. At this time, regarding recollection or remembrance of the symptoms, there is something additional. Instead of fast, it is be fast. Fast has the same meaning, but B means having balance problems or trouble maintaining or having balance. E means eye or vision problems, so suddenly not being able to see well. So if these occur, then one should be fast and either call an ambulance immediately or get to a nearby hospital immediately. There are other symptoms which could occur based on the place of the brain infarct or the brain bleed. These are shortage of breath, abnormal heart rhythm or irregular pulse, confusion, numbness, tingling sensation in a part of the body, any part of the body or half of the body, dizziness, not being able to hear well, loss of coordination, clumsiness, uncontrollable tremors or shaking, rapid uncontrolled movements of the eye, which is called nystagmus, loss or impairment of sense organs could occur, such as loss of taste or loss of smell, and loss of smell is called anosmia. Nausea and or vomiting could also occur. Involuntary or uncontrolled urination or involuntary bowel movements or involuntary passing of stools or defecation may occur among some people. If the brain infarct or brain hemorrhage is large, then more problems could arise, such as severe headaches, seizures, and more. Seizure or epileptic attack and more could occur. The Glasgow Coma Scale is also used to assess how conscious the person is and what the person's neurological condition is, or what the neurological state is. This is essential in determining the severity of the stroke. The affected people, as you already know, would have a different appearance, as already explained. The face might look like this, the face of the person. Do you see how the corner of the mouth, the eyelid, and the eyebrow are sinking or drooping on one side of the face? This is the F of fast, or this is the F of be fast, as previously explained. Okay. This is another example of facial drooping. There is also a weakness of muscles in one half of the body. Here we can see a weakness of arm on one side of the body. This picture is not perfect, but there is a difference in the muscle strength between the two arms. On one side, there is little or no strength. On the other side, the strength is usually normal. The following is my knowledge, which I acquired during my medical studies in India and during my work in India. The physical examination, which usually takes place from head to toe, must be done very fast or quickly when we examine a person physically who is experiencing the symptoms of a stroke. That is why doctors first look for anything in the affected person that might be unusual or pathological. So they look for the unusual things first instead of doing the whole thing from A to Z. Okay. The following examinations are done by the doctor or the paramedic to get a rough estimate or a rough idea about the person's condition or state. The doctor tells the affected person to extend the arms forward, or the doctor moves the person's arms forward, and then the doctor tells the person to hold the arms in that way. Normally, it is possible to do that, but if there is a stroke, then usually one arm comes down immediately or within a few seconds. Short sentences or small sentences are told to the person, and the person is requested to repeat those sentences. The person is asked for information about the current date, the person's own name, the name of the city where the person lives, and other questions are asked. And these questions are asked to test how severely the person's memory is affected. The person is also asked to smile. If affected, the person's face might look like this when the person tries to smile. To confirm if the person has facial paralysis, because this is a symptom of facial paralysis, the person might also be asked to puff out their mouth with air or to fill their cheeks with air like this. If there is a one-sided facial paralysis, then the person will not be able to do this properly. What I have explained so far is usually done very quickly so that everything could be understood well. I'm explaining this in detail and clearly. Okay. So additionally, a thorough physical examination is done at the hospital from head to toes. The examination starts at the eyes, or it starts from the eyes, So how do the pupils look like? That is examined. Are they dilated or wide, or are they normal, or are they constricted or narrow, or is there any unequal size of the pupils between the two eyes? That is checked. And if there is a size difference, then in medical terms it is called anisocoria or anisocoria. Okay. The pupillary light reflex is done to see if the pupils constrict or contract sufficiently due to the presence of light. For this, we shine some light into the eyes of the person, but from the outside inwards, like this, or in this way. Normally, during this reflex or during this examination, there is a constriction of the pupil, and that happens if this examination is done in a room that is not too bright. The light from my pen torch is a little strong. That's why the normal state was not visible. I hope the constriction or the change is visible in this video. How the pupils of the person would look like if the person has the symptoms of a stroke depends on the location of the brain infarct or on the location of the brain hemorrhage. Normally, the condition of the pupils is unaffected after a brain infarct, and usually the pupils are dilated after a brain hemorrhage. But this can vary. Okay. The visual field would also be slightly impaired among the people with a stroke, and depending on the location of the brain infarct or the brain bleed, there are different types of impairment of vision or loss of vision, such as scotoma, hemianopsia, etc. If the person has a scotoma, the visual field could be like this. This is another type of scotoma. Two different types of scotoma. This is another type. It is called scintillating scotoma. You could read about scotoma and its different types on the website of Cleveland Clinic or on the website of Wikipedia if you would like to. The visual field, or what a person normally sees, would be this way. This is what the person sees through the left eye, and this is what the person sees through the right eye, or that's how it appears. Among people who had a stroke, the visual field could be this way or this way. These are two types of homonymous hemianopia or homonymous hemianopsia. There is also a heteronymous hemianopia or hemianopsia, this or this. But I read that among people who had a stroke, usually homonymous hemianopia is present. Hemianopsia is an impairment of one half of the visual field. In this case, there is a brain infarct or a brain hemorrhage on the right side of the brain. But you would ask, why are there problems in both eyes if there is a one-sided issue in the brain? That happens because of the optic chiasma, which is a crossing over of the optic nerves, and it is a result of evolution. Anatomically, it should probably be shown this way, but so that the others could understand this better, I'm using a mirror image of what's anatomically correct. Okay. How this crossover works is complicated to understand, but how the images or the reflected light from the images or from the objects are captured by the retina is shown through two different colors in this image. After a stroke, the field of vision could be impaired in this way, or the visual field could be impaired in this way. There is also an image of the city for comparison, or it is something that represents the visual field of normal, healthy people. You could read more about hemianopsia on the websites of Wikipedia or on the website of Cleveland Clinic if you would like to. There is also a visual impairment known as quadrant anopia, in which a quarter of the visual field is affected. These images show which part of the visual field could be affected due to the stroke if the person has quadrant anopia. I mean, if the person has stroke and then has this visual impairment or visual issue, the parts of the visual field which could be affected depends on the location of the damage or where the brain infarct or the brain hemorrhage is. If quadrant anopia is present, the affected person's visual field could be like this. But I read that if quadrant anopia is due to a stroke, then usually the upper quadrants of the visual field are affected, either the left or the right quadrants. You could read more about quadrant anopia on the website of Wikipedia if you would like to. There are some physical examinations and some other investigations to examine the visual field of a person, such as perimetry. But these examinations could also be done later on after the treatment was started or after the treatment has been started. According to the American Heart Association, about 65% of stroke survivors or 65% of the people who had a stroke experience problems with their vision. As already explained, during the physical examination, it will be observed whether the person has any complaints such as facial drooping, weakness in the muscles of the limbs, slurred speech, and unnatural smile, and other things. In addition to this observation, the physical examination of the affected person is done thoroughly at the hospital. But this examination is done focusing on at least 4 aspects. The examination is done to check if there is any muscle wasting, how the tone of the muscles is, how strong the muscles are, whether there are any brisk or weak reflexes. Okay, and regarding muscle wasting, I should say that when a person is paralyzed or when the person can hardly move, it eventually leads to muscle wasting. During the practical year or the internship of our medical studies, every day we as interns had to measure the circumference of the limbs of all the patients who had suffered a stroke. This measurement was done using a measuring tape, and then the values had to be informed to the head doctor or the doctor treating that patient. In this way, the doctors keep track of the patient's condition and to know if there is improvement or worsening of the patient's condition, or to know if there is any muscle wasting. Among the affected people, the strength of their muscles will be greatly reduced, or there will be no strength at all. An examination is done to assess the muscle power of the affected people or of the affected person. There is a scale from grade 0 to grade 5 to assess the strength of the muscles. And during a few parts of this examination of the power of muscles, we apply a little resistance to that limb or against that limb, and we ask the affected person to move that limb against the applied resistance. After instructions to move a limb, if the affected person is unable to move a limb, and if not even contractions of that particular muscle are visible, then the power is grade 0 on this scale. If the person is unable to move the limb, but there are slight contractions of the muscle visible when the person tries to move the limb, then the power of that particular muscle is of grade 1 on this scale. If the person is able to move a limb to the sides but not against gravity, then the power is of grade 2 on this scale. If the person can move their limb against gravity but not against mild resistance, then the power of that muscle is of grade 3 on this scale. If there are movements against gravity and against slight resistance, then the power is of grade 4 on this scale. Normally, a doctor holds the limb of the person and applies pressure against that limb, and the person has to move the limb against that pressure. But I am using a book here. If the person is able to move the limb even against strong resistance, then the power of that muscle or that group of muscles is of grade 5 or normal strength. In a similar way, the power of the muscles of the other limbs are also examined. The next examination is an examination of the power of the muscles of the hands. During this investigation, the doctor places 2 of his fingers in the hand of the affected person in this way. Then the person is instructed to hold those 2 fingers of the doctor tightly. And after that, the doctor tries to pull back his fingers to himself. If affected, the person would not be able to hold those 2 fingers of the doctor. But if the person has normal power, then the doctor would not be able to pull his fingers back to himself. I mean, if the person is very strong. Normally, these muscles are examined to assess the power of the muscles, but based on the symptoms of the person, and if anything else appears abnormal to the treating doctor, then more muscles could get thoroughly examined. The next examination is the examination of the tone of the muscles. Normally, there is a slight tension or tone in all the muscles. The affected person's face might look like this because of that tone. On one side of the face, the man has lost control of the muscles and there is no tone. The appearance of the person's face is due to the normal tone of the muscles on the other healthy side of his face. We can also see redness in one eye because the man cannot close that eye due to the facial paralysis. Okay, and the arms or hands of the affected people might look like this. This happens when the muscle tension increases or muscle tone increases. This usually occurs among people with a brain hemorrhage or a brain bleed. Among people with a brain infarct, there is usually atonia and areflexia on the affected side. Atonia means no tone in the muscles, and areflexia means the absence of reflexes. A reduced type of these aspects or a reduction in the strength of these aspects could also be present. They are called hypotonia and hyporeflexia, where the tone and reflexes are weaker, but they are not completely absent. Patients with brain hemorrhage or brain bleed usually have hyperreflexia and hypertonia. Hyperreflexia means brisk or exaggerated reflexes, and hypertonia means increased tone in the muscles of the body. These are some other terms for increased tone. When the doctor moves any limb of the person this way, then the tone of the muscle can be felt or identified by the doctor. If the person has hypertonia, then this movement will be a little bit more difficult. There will be more resistance. If the person has atonia, then the doctor can move the affected person's paralyzed or weak limbs very smoothly and without any resistance, like this. No resistance. In a similar way, the tone of the muscles of the other limbs is also examined. The next part of the physical examination is the assessment of the reflexes, which is done to check the status of the nervous system. Using a reflex hammer or a knee hammer and a pen torch or a torchlight, we can elicit reflexes in the body. Among people with a brain hemorrhage, brisk or exaggerated reflexes are elicited. Among people with a brain infarct, there is either absence of reflexes or presence of very weak or diminished reflexes. There are many reflexes that can be typically elicited or elicited in the body. The following are a few of those reflexes. And at the beginning of this video, I have already tried to show the light reflex. The biceps tendon reflex or biceps reflex occurs through the musculus biceps brachii muscle or the biceps muscle. This muscle is the flexor muscle of the arm. The tendon of the biceps muscle is in this area. Normally, to elicit or to trigger the biceps reflex or the biceps tendon reflex, the biceps tendon is held this way with one hand so that the thumb of the hand is on the biceps tendon, and then the thumb is struck with the reflex hammer, and after the stimulus there will be a flexion or bending at the elbow joint. Since I live alone at the moment, I will have to modify this examination a little. If you are able to observe closely, you will be able to see slight contractions of the muscle in this area. Please pay attention to this area. You will be able to see slight contractions of the muscle. I hope the slight contractions are visible to you, very slight. The triceps tendon reflex or the triceps reflex occurs through the musculus triceps brachii muscle or the triceps. This muscle is the extensor muscle of the arm, and the triceps tendon is located in this area. To elicit or to trigger the triceps reflex, the triceps tendon must be struck here with a reflex hammer. Normally, the doctor holds the arm of the person in this area, and then he tells the person to loosen the muscles in the arm and to not contract the muscles. After that, he hits the triceps tendon, which is in this area. Okay, and after the strike or after this trigger, or after the stimulus, there is an extension or straightening of the forearm at the elbow joint. There are also contractions of the muscle. Right now I'm alone, so I will have to modify this test a little bit to show the reflex a little clearly. I hope the contractions of the triceps muscle are visible. The patellar tendon reflex or patellar reflex or the knee reflex occurs through the musculus quadriceps femoris muscle or the quadriceps muscle. These muscles are the extensor muscles of the thigh or the quadriceps, and the patellar tendon is in this area. In order to elicit or trigger this reflex, the patellar tendon needs to be struck or hit by the reflex hammer. After the stimulus, there are contractions of the muscle in the thigh area, and there is an extension of the leg at the knee joint. Either could be present. So that here is the tendon, the patellar tendon. I hope you're able to see the contraction of the muscle. In order to trigger the Achilles reflex, one has to strike the Achilles tendon with a reflex hammer. The contraction of the calf muscles appears in this area. There could also be a plantar flexion of the foot, or the movement of the foot towards the floor area or downwards. I hope you are able to see the contraction of the calf muscles and the plantar flexion of the foot. The Babinski reflex occurs through some muscles of the foot. This reflex is usually done when the person is lying down or when the legs of the person are stretched. To trigger this reflex, one does not strike a tendon, but one must move the part of a reflex hammer or any hammer or something on the sole of the foot. This is how the examination is done. Normally there is a negative Babinski reflex in healthy people, and that's normal. If there is a plantar flexion of all the toes after the stimulus, then it is considered negative. Like this. This is normal. This is a negative Babinski reflex. It is described as a positive Babinski reflex when after the stimulus there is a simultaneous dorsiflexion of the great toe or upward movement of the great toe and plantar flexion or fanning out of the other toes. That is positive, a positive Babinski reflex. These are some important terms related to the Babinski reflex. One could read more about them if interested. Despite all the things I've explained regarding this reflex, one should know that among children who are between 6 months and 2 years of age, a positive Babinski reflex is normal. It is not considered as something pathological. So one doesn't need to worry about that if a positive reflex is elicited among children between 6 months of age and 2 years of age. And in order to elicit or in order to trigger the Babinski reflex, we use a part of the knee hammer or something else that is not very sharp. As I was working in India, I used the key of my motorcycle for this, or the tip of the key. If you try to do this, then I request you to not overdo it. Please don't overdo it if you try to do this. Okay, so moving on. I should let you know that so far I have been able to elicit the positive Babinski reflex in only one person till now. It was about 8 or 8.5 years ago, and it was a patient with tuberculosis. So I assume that these bacteria had also reached the central nervous system of the person. As the patient didn't stay for a longer duration at the hospital, the necessary investigations could not be done to confirm this. And I can explain more about the reflexes, the relevant nerve roots, how the nerve roots are formed, etc. But this video would be very, very long if I do that. That's why I'm moving on. I'm sorry. Okay, so the reflexes of the person, the appearance of the person, and the tone of the muscles in the affected person will be regularly monitored and examined by the doctors so that any improvement or any deterioration can be made visible. Okay, and if the person presents to the hospital with these complaints of a stroke, a thorough examination of the muscles and reflexes could also be performed later on. I mean, after the admission of the person in the hospital. because we need to get to the treatment first, right? I mean, treatment faster, right? But the important complaints and tests are the examination of the muscle strength, the presence of a slurred speech in the person, and the person's appearance, and a few other things. These are examined by the paramedics after they reach the after they reach the affected person, or after uh, you know these people, the affected person is checked by the doctors after the person reaches the hospital. Okay. And one should know that different people may experience more or less symptoms. This depends on the size and location of the infarct or the brain hemorrhage. If there are more symptoms such as loss of smell, loss of taste, or loss of hearing, then normally the nerves would not be checked individually. However, the affected people may be advised to do such checks or to retrain their senses if possible. A special medical examination of these sense organs would not be necessary because after timely treatment, there is a slow improvement of the damaged parts of the brain, leading to a re-establishment of the function of these sense organs. An important thing to know is that there is a difference between the sides. I mean, the side of the body that is affected after the stroke and the side of the brain that is affected are not the same. By that, I mean the following. After a left-sided brain infarct or a left-sided brain bleed, symptoms are to be expected on the right side of the body. The same applies to a right-sided stroke, after which the symptoms occur on the left side of the body. You could wonder what the reason of this difference between the sides is. There is a crossing over of the nerves at the level of the medulla oblongata, or approximately at the neck level. But this crossing over of nerves is not complete. I read that this crossing over is a result of evolution. The occurrence of the symptoms depends on the part of the brain which is affected. But as already explained, the vision of both eyes could be affected if there is a one-sided brain infarct or a one-sided brain bleed, and that is because of the crossing over of the optic nerves. I'm sorry, it is confusing, but I hope I haven't made any mistakes in explaining this. Okay, so what can we do if a person suddenly develops the symptoms of facial drooping, limb weakness, and the other issues which I mentioned? An ambulance must be called immediately. No other job. First calling the ambulance. That's the first step. And if the person is near a hospital, then the person must immediately go to the hospital, or the person must be immediately taken to the hospital. I'm expressing the following what I learned in a course at the American Heart Association. So what happens is that after an ambulance reaches the affected person, and if the paramedics find the signs of a stroke, they would immediately begin their journey to the hospital with the person. And during that journey, they would call a nearby hospital and a stroke protocol will be activated. This is done to examine the person as soon as possible, investigate and confirm the type of stroke, and after that, begin the appropriate treatment for the person as soon as possible. And when the affected person reaches the hospital by an ambulance, the team is already ready and everything is done as quickly as possible. The first step would be to rapidly admit the person to a stroke unit or to an intensive care unit. And then the first step of the treatment is to check the blood sugar levels, to check the blood levels of electrolytes, and to record the vital signs such as blood pressure, oxygen saturation, pulse, etc. It is very important to check the blood sugar levels because people with low blood sugar levels, with low blood sugar, have no energy, and as a result of that, there are problems such as generalized weakness or weakness of the limbs, and there are also words or sentences that are unclear or incoherent. These symptoms look like the symptoms of a stroke, and if there is an elevated blood sugar level, or if there is an elevated level of sugars in the blood, there is a neurological impairment due to the excessive sugars in the blood. As a result, symptoms similar to the symptoms of a stroke occur. After obtaining the blood sugar levels, the treatment is done mostly intravenously or through the veins of the affected person. Depending on the blood sugar levels, treatment is done either with 10% dextrose, octreotide, glucagon, and other agents, or with insulin, fluids, intravenous fluids, and electrolytes. With elevated blood sugar levels or among diabetic people, there is increased urination or increased frequency and increased volume of urine. Therefore, electrolytes such as sodium, potassium, etc. must be restored in the body of the person because they are excreted due to the increased urination. They are excreted even more due to the increased urination. And people with these symptoms and a high blood sugar level are offered clear oral fluids to improve their condition because clear fluids dilute the blood and that reduces the blood sugar level. People with low blood sugar level are offered juices to improve their condition, but the intake of any juice or any other liquid does not happen directly through the mouth of the person, and that is common among both the cases, increased or reduced blood sugar levels. No one gets any liquids or any food or anything directly through the mouth. A feeding tube is placed or inserted, and these fluids are given through the feeding tube. I will explain about this soon. But regarding why fluids are to be given to the people with elevated blood sugar level, some explanation is necessary. Because of the increase of blood sugar levels, there is an increase in urination among these people. As a result of that, the amount of fluids in the body reduces, which leads to other issues. That is why intravenous fluids and fluids through the feeding tube are to be given to restore the amount of fluids in the body and in the blood vessels in order to try to reduce the issues and symptoms. You should also know that when the kidneys get a better blood supply, they can efficiently excrete or remove the excess sugars from the blood, which would improve the condition of the person. This is a simplified explanation of what happens here. During this time or after the people with these symptoms of a stroke arrive at the hospital, a Foley's catheter will be inserted or placed into the urinary bladder of the affected people. Foley's catheter will be placed. That will be done because these people have symptoms of loss of control over urination. Okay. The urine bag also helps in doing a few things or in a few analysis or to determine a few things. It helps us analyze whether the fluid intake should be increased and whether the person needs additional treatment. The amount of urine collected and the color of urine are important parameters here. Okay. A CT scan or MRI scan of the person's brain must be performed as soon as possible to rule out a stroke. But before any imaging procedure can begin, the blood glucose levels must be checked because a CT scan takes at least 10 minutes and an MRI scan takes approximately 30 minutes to complete. Let us assume that the affected person suffers from diabetes and is about to undergo a CT or MRI scan. If the blood glucose levels are not checked and if the person has an imbalance of blood glucose, then the person's condition will worsen continuously before the imaging procedure is done. That's why a quick blood sugar level check is done using a glucometer. And one should know that the fasting blood glucose levels range between 70 and 100 milligrams per deciliter. But this fasting blood glucose level could be even lower among athletic people. Okay. And 2 hours after a meal, the level of blood sugars should be less than 180 milligrams per deciliter among healthy people. And the values you see now on the screen are blood glucose levels among people who do not have diabetes or people who are not diabetic. Among diabetic people, the blood sugar levels are elevated, and if a diabetic person has symptoms of a stroke, which is due to the elevated blood sugar levels, then their blood sugar levels are very high. I would like to share an experience regarding this with you. Okay, as I worked at a hospital in India, a male patient or a male person or a man came to the hospital with generalized weakness and paralysis of all his limbs. He also had a few other complaints, which, are like the symptoms of a stroke. So we found out that the person is also diabetic and he had a blood sugar level of at least 400 milligrams per deciliter. I am saying at least 400 milligrams per deciliter because this is the maximum value of blood sugars which this particular device could measure or detect. And if the value of the blood sugars is more than 400 milligrams per deciliter, that device showed high as a result. The result of this check in this person was high. A small amount of blood was collected for investigations and then he was given intravenous fluids, after which there was also an infusion of insulin. A CT scan of his brain was done to rule out a stroke. The CT scan was normal, and with that I mean in the CT scan of his brain, there was neither any evidence of a brain infarct nor that of a brain bleed. Okay, and I should say that after arriving at the hospital, this patient was in the emergency room for around 2.5 hours. That was where the treatment with intravenous fluids and that insulin infusion happened. And by the time this patient reached us in the ward side or the room side, he was already in a normal condition and he didn't have any paralyzed or weak limbs anymore because his blood sugar level reached the normal limit by then, I assumed. And then the lab result for his blood sugar level was ready. It was approximately 600 milligrams per deciliter. I think it was more than 600 milligrams per deciliter. This is the result of that blood sample which was collected shortly after this man or this patient arrived at the hospital. And after this, he was treated appropriately. But before we could confirm the reason of this imbalance, the patient left the hospital in a healthier and in a better condition, I should say. I apologize for not remembering the exact value as this happened about 7 years ago. If a person has hypoglycemia, a bolus of dextrose must be given first. Either dextrose or one of these medications or preparations could be given. There are even more preparations which could be given for improvement of the person from this condition. The emergency physician or the neurophysician or the other treating doctor decides what medication and how much of it the affected person should receive. The treating doctor makes this decision based on the affected person's blood sugar level and the affected person's body weight. In case of hypoglycemia, or if the affected person has low blood glucose levels, and after the appropriate treatment is done through a rapid administration or bolus of dextrose or other appropriate medicines, which I previously explained, and despite the improvement which might occur, a CT or MRI scan of the brain will be done to rule out a stroke or to exclude the possibility of a stroke. CT scan of the brain is usually the test done to exclude or rule out a stroke. An MRI of the brain could also be done. Although MRI has its advantages over CT, CT scan of the brain is preferred over MRI because CT machines are available at most hospitals and at almost all the diagnostic centers. CT scan can provide results faster, which allows the doctors to start the appropriate treatment as soon as possible. Now comes the important question, maybe. How would the images of the brain or results look like if there is a brain infarct after they were collected or after the person is investigated through a CT scan? This is an image of the brain or an image of a slide of the brain of an affected person which was taken by CT. Hopefully you can understand what is wrong here. In this image, the changes have been enhanced. Okay, on one side, the brain looks normal, and there is an infarct on the other side of the brain. But the affected part wouldn't be this dark or black, I think. For our understanding, the changes in this image are a little over enhanced. Okay. This is a CT image of the brain of a person with a subarachnoid hemorrhage. This is a bleeding that happens into the subarachnoid space. Again, in this image, the change or the bleeding is a bit enhanced. And one should know that sometimes it is harder to find the subarachnoid hemorrhage because there are no major obvious bleedings, as we can see in this CT image. Here there is a brain hemorrhage in a cerebral sulcus. Okay, and this is a brain hemorrhage in a cerebral ventricle. Hopefully the brain bleed is visible. And this is an intracerebral hemorrhage. There is also a collection of fluid or edema around the hemorrhage in this, as we can see in this image. The changes I've shown you so far are just a few examples of stroke. These pathological changes can also occur in the midbrain, cerebellum, thalamus, etc. Here you can see an infarct in the cerebellum or small brain, and this image was obtained using an MRI scan or through an MRI scan. In this image we can see small infarcts which were captured by CT. There are a few small lacunar infarcts here which occur due to the blockage of the smaller, deeper arteries of the brain. Stroke can occur even when there are no or almost no risk factors, and this can happen from a brain hemorrhage which could occur after a head injury or an accident. The fracture of the skull is also made visible in this image. Hopefully it is visible to you. Then one may have an important question. Is it possible that the person is paralyzed or has a generalized weakness even though there is neither a brain infarct nor a brain bleed? Then I would say yes, that is also possible. It is possible in a person with TIA or a transient ischemic attack. The the paralysis or the weakness a person with TIA would experience would subside within 24 hours, or it would reduce within 24 hours after the symptoms began. There was a blockage in the affected artery, but it was short term. And then the blood supply to the affected areas of the brain returned. So that's why there are no long term problems or issues like paralysis or weakness. And TIAs are considered as warning signs of a true stroke, and they should be treated as an emergency because a brain infarct is extremely possible in this person, and that is really possible in the near future. Okay. And when a person has TIA, then they are treated with the same medicines which are used to treat a stroke, but treatments like or treatment methods like thrombolysis are not used, or they are not done. And in order to do a thrombolysis, actually evidence of an infarct in the brain is necessary. So other than the thrombolysis, the rest of the same treatment is done, which is done to treat a person with a brain infarct. And thrombolysis is not done as no infarct is visible on the CT, or as no infarct would be visible on the CT. The goal of this treatment is to prevent further cerebrovascular accidents such as a brain infarct or some other vascular problems. If interested, you could read about TIA on the website of Cleveland Clinic or on the website of Wikipedia. I'm sorry that I haven't yet shared any pictures of a normal healthy brain for comparison. This is what or how a healthy brain would look like when examined through a CT, or that's how it looks like on CT. Then you would have an important question. Why does a brain infarct look black or dark on CT and a hemorrhage look white? Yeah, but before I explain about that, I have to show you something different. This is a diagrammatic representation of a sodium-potassium pump. This pump is a transmembrane protein, which among other things is very important for the balance of electrolytes, for the voltage of the cells, and for other things between the inside and outside of the brain cells or normal cells. So this pump is necessary for some kind of a balance between the outer and inner side of the brain cells and the normal cells. But in order to work, this sodium potassium pump requires energy because of the blockage of the artery or the arteries that supply blood to the brain or to parts of the brain. There is less or no supply of glucose, oxygen, and other nutrients to the affected parts of the brain. Due to the less or no presence of glucose, less or no energy or less or no ATP is produced. Because of the reduced or no production of energy or ATP, the sodium potassium pump doesn't work properly. Due to the improper function of the sodium potassium pump, more sodium starts accumulating inside the brain cells. Additionally, due to the improper internal maintenance of the body, some irregular activities occur which results in an increase of sodium ions and calcium ions in these brain cells. As a result of increased sodium in these brain cells, water enters these brain cells through osmosis. This accumulated water or this edema is cytotoxic, or it damages the cell. Because of this edema or because of this accumulated water, the radio density of the affected parts in the brain reduces, and that happens because water dilutes the interior of the brain cells. Extra water in the brain cells dilutes the brain cells. Because of this, the affected areas of the brain appear darker on CT. Because of the improper function of the sodium-potassium pump, because of the accumulation of water within the brain cells, and because of the other changes I explained, there is a reduction in movement of water molecules into and out of the brain cells. This reduction is called restricted diffusion. Due to restricted diffusion and because of the edema or the accumulated water inside the brain cells, the infarct appears differently on different aspects or sequences of MRI. The images of the infarct and the values which are acquired through these investigations are helpful in selecting the best possible method for treating the person with a brain infarct. Coming to the part about a brain bleed, I need to explain that red blood cells have a higher density, and the density of any area increases when red blood cells accumulate there. Due to this, the radio density of the area in the brain with the bleeding is higher than the radio density of the area with the normal brain tissue. That is why areas with bleeding appear as hyperdense areas or whitish areas on CT, which appear somewhat like bone. And bones have that whitish appearance on CT because they are radio opaque, and tissues are not radio opaque normally. And due to this reason, which I've just explained, more X-rays are absorbed, or they are not allowed to pass through the area with the bleeding, which is why the bleeding appears as whitish areas or hyperdense areas on CT images. The brain bleeds appear differently on different imaging methods and on different aspects or sequences of MRI like T1 and T2. This appearance changes over the course of time. I hope you can see the brain bleeds or brain bleed which I have highlighted using arrows. According to the status of this accumulated blood or hematoma, and according to the age of the bleeding, the appearance of the bleeding changes on different methods of imaging or on different imaging methods. I found this table on a German medical website. Hopefully this table is helpful to understand how the brain bleeds appear on different imaging methods and how this appearance changes with the passing of time. The explanation of how and why these changes happen is quite lengthy. A neuroradiologist from Belgium has covered this explanation in detail. In this video, it's explained. This video is a little long, but it is helpful in understanding what changes happen in that area or in those areas and more. Please watch if you would like to, or if you would want to know more about it. You could also read about stroke on the website of the Cleveland Clinic and on the website of Wikipedia if you would like to. Okay, regarding the investigations, I should say that additionally, lipid profile or a laboratory test of cholesterol levels in the blood will be done. Even the test of a complete blood picture is done. A medical history will be taken or collected, which includes questions about the habits of the person, previous illnesses, and genetic illnesses in the family, such as amyloid angiopathies. If necessary, additional tests or investigations will be done. This is a result of a lipid profile test of mine, which was done a long time ago. These are the important borders or ranges that one could be aware of. But I read that after a brain infarct, the blood value of LDL cholesterol should be reduced to below 70 milligrams per deciliter, and this is done with the help of statins. Statins like atorvastatin, rosuvastatin, simvastatin, etc. are used to create or cause this reduction of blood level of LDL cholesterol. Okay, perhaps I need to explain the most important part of this video, probably the treatment of a stroke. And one should know that the longer the person doesn't receive the treatment, the more permanent the symptoms become, because the longer the treatment is delayed, the more the brain cells die irreversibly, and the more long term or permanent the symptoms or problems become. And that is why doctors say time is brain. Why is this so? Brain infarct occurs due to the absence of blood supply, and brain hemorrhage occurs because of the rupture of a normal artery or of an aneurysm. And the longer the blood supply of the brain is not restored after a brain infarct, and the longer the underlying problems are not treated after a brain bleed starts, the more the brain cells will irreversibly die and the more permanent the damage becomes. But if we can quickly re-establish the blood supply after a brain infarct and quickly treat the existing problems in the case of a brain bleed or a brain hemorrhage, then we can reverse the impairment of the nervous system. That is the main goal of the treatment. The next goal of the treatment is to prevent the consequences of this stroke and the development of another stroke. These are the medicines that are normally used to unclog or unblock or to clear a blocked artery. They are called thrombolytics. Alteplase is commonly used for that. As far as I know, Alteplase is the best medication or thrombolytic to break down and dissolve the clot that blocked the artery and caused a brain infarct in the person. Thrombolysis is the name of the procedure of giving this medicine for the lysis of the blood clot or for breaking down the blood clot among the people with an infarct, or in this case a brain infarct. Let us assume that this is the cavity of a blocked blood vessel. A blood clot has blocked this artery. Fibrin is a glycoprotein which is a part of the blood clot, and that is visible in this two-dimensional image. Fibrin forms a network to stabilize the blood clots. The thrombolytic agent lyses or breaks down the fibrin. By breaking down fibrin, the medication breaks down the blood clot that has blocked the artery or that was blocking the artery. Because of the thrombolytic agent, a condition or a state is created in the blood in which the fibrin is broken down, and this is a fibrinolytic condition. I should mention that there is a small risk of bleeding in the body or in the brain of the person when the person who has a brain infarct is treated with thrombolysis. Such bleedings could happen due to the fibrinolytic state. According to one study, there is a 6% chance of an intracerebral bleeding or a brain hemorrhage, a 2% chance of a major bleeding anywhere in the body, and a 5% chance of angioedema when a person with a brain infarct is treated through thrombolysis. But according to the American Heart Association, despite these risks, thrombolysis improves the chances of recovery by 30%. Usually, alteplase is the medicine that is given to dissolve the blood clot, and after the thrombolytic is prepared into an intravenously injectable medication, the first 10% of the thrombolytic preparation is given as a bolus, and the remaining 90% is given slowly over an hour. Other thrombolytic agents may also be given for the same cause, such as streptokinase and tenecteplase. Streptokinase is still administered in rural areas of India to break down and dissolve the clot which caused the brain infarct among the affected people. Streptokinase is prescribed because in comparison to streptokinase, alteplase is very expensive. And like alteplase, streptokinase is not fibrin specific, which is why bleedings could occur anywhere in the body after its administration or usage. But streptokinase is something people living in the rural areas of India can afford. Alteplase has the best effect. Tenecteplase is another thrombolytic that could be administered. Tenecteplase is fibrin specific like alteplase, and it has almost the same efficacy or effect as that of alteplase. It is cheaper than alteplase, but tenecteplase is more expensive and better than streptokinase. Tenecteplase is more fibrin specific than alteplase. It has a longer half-life and it can be administered in a rapid single dose. Tenecteplase has been proven to be not inferior when compared to alteplase, but the drug superiority of tenecteplase over alteplase has not yet been proven. I mean, even now alteplase has the drug superiority. For this reason, alteplase is preferred over tenecteplase as a thrombolytic of choice in order to treat a person with a brain infarct. But tenecteplase could be used as an alternative of alteplase in the cases of brain infarct. The use or the administration of the thrombolytic depends on the decision of the treating doctor, and maybe also on the affordability of the affected person or what the affected person can afford. As I explained earlier, there are more thrombolytics such as reteplase and urokinase. In the rural areas of India, urokinase is still administered to treat a person with a brain infarct because it is very cheap and because it is something the people can afford, although it has many side effects. And reteplase is expensive or more expensive than urokinase, and based on the affected person's financial state, reteplase could be given because reteplase is fibrin specific but less fibrin specific than alteplase and tenecteplase. Urokinase is not fibrin specific, and these two thrombolytics have little positive effect after administration, and they are associated with a higher risk of bleeding, which is why they should not be used or given for the treatment of a brain infarct if possible. I apologize for sharing with you the prices of these drugs which are used to treat a person with a brain infarct and which are expensive in India. Maybe this is something about which our government could do something, to help the people of India who live in the rural areas of India and cannot afford the best but expensive medicines like alteplase. Okay. And there are criteria that must be fulfilled in order to treat an affected person through thrombolysis, or in order to treat a person with a brain infarct through thrombolysis. Actually, these are contraindications, and a criterion is fulfilled when a contraindication is absent. There are absolute contraindications and relative contraindications. These are the absolute contraindications. If even one of these contraindications is present among or in the affected person, then thrombolysis should not be done. Otherwise, serious complications are possible. And these are the relative contraindications. To treat the affected person properly, the person who has a brain infarct, the treating doctor carefully evaluates the person and decides whether thrombolysis can be done, and the necessary investigations could be done in order to make that decision. But sometimes thrombolysis is done, or thrombolytic is given, even though one or some of the relative contraindications exist or are present in the person, because the goal of the thrombolysis is to save as much brain tissue as possible and to prevent or reduce brain damage and disability. If bleedings or other problems would occur, then there are treatments available for that, but we cannot reverse the conditions or states of death and long-term or permanent disabilities. Sometimes thrombolysis could be selected as a treatment method even though the individual has absolute contraindications. That is done when the thrombolysis may do some good despite the risks it involves. But that is the decision of the treating doctor, and this decision is made on the basis of the affected person's current condition, the person's pre-existing issues or conditions the person has, the person's previous medical history, and many other factors. It is also necessary to treat the affected person with thrombolysis within 4.5 hours after the symptoms of stroke have begun, because a delay in the treatment would lead to permanent death of the brain tissue and to long-term problems or symptoms. These are the complications or problems uh, that the affected person could have during or after thrombolysis. Basically, they are deteriorations of the symptoms of stroke which the person already has. But complications such as seizures, thunderclap headaches, allergic reactions to the thrombolytic, and a few other complications are something additional which could develop. Due to the complications that could arise during or after thrombolysis, the person could also fall into a coma, or the person could become comatose. That's why the person is constantly monitored and their blood pressure and their condition are checked once every 15 minutes. These are the signs of a sudden rapid bleeding anywhere in the body, and that of a brain hemorrhage. If symptoms or signs of any of these two bleedings develop, then the hemorrhage or the bleeding can be confirmed by CT scan of the suspected area. But if the symptoms of a hemorrhage occur, then the thrombolysis is stopped immediately. After the thrombolysis is stopped, another treatment is started to treat the problems which have freshly started. Aminocaproic acid and tranexamic acid are the antidotes that can help reverse the fibrinolytic state which was caused or created by the thrombolytic. Transfusions with platelets and cryoprecipitate would be necessary to correct the fibrinolytic state which was caused by the thrombolytic agent. Prothrombinase complex concentrate would also be given to stop this bleeding. It contains some blood clotting factors. Vitamin K is also administered. Despite these risks, thrombolysis helps. As already explained, it leads to a 30% improvement in the chances of recovery. Catheter-directed thrombolysis could also be used as a treatment method. During this method, more medication is injected or released into the blocked artery through a catheter near the blockage or even into the blood clot. But compared to a systemic thrombolysis that is normally done through a vein, a smaller dose of the total medication would be required in a catheter directed thrombolysis. Because of the small amount of the medication which is used, lesser amount of the medication spreads throughout the body. As a result, possible complications which could develop in the body due to the medication could be reduced or prevented. Catheter-directed thrombolysis could be used as a treatment measure among the elderly and among people with complications. For example, among people who have the contraindications of thrombolysis and other things. Additionally, statins, intravenous fluids, antiplatelet drugs such as aspirin and other medicines are administered, but the medicines that dilute or thin the blood and the medicines that prevent the platelets from performing their functions properly are administered at least 24 hours after thrombolysis. After thrombolysis, only 81 milligrams of aspirin should be administered for at least 1 day so that no bleeding would occur or so that the risk of bleeding is not increased. And after this risk period is through or done, treatment with only aspirin would not be very effective in leading to a good improvement. But if aspirin is given along with another antiplatelet medicine such as clopidogrel, then a better effect or better recovery can be achieved. And this therapy is called dual antiplatelet therapy. Fluid therapy also helps in the recovery, especially as intravenous fluid infusion. The goal of fluid therapy is to restore oxygen supply to the brain tissue. When the amount of fluid in the body increases, the cardiac output increases. When the amount of fluid in the blood would increase after this infusion or through such infusions, and after that, the cardiac output increases. Cardiac output is the amount of blood pumped by the heart. As a result, the blood supply and the oxygen supply to the tissues increases, and even to the brain tissue. Among the abnormal changes that occur in the body after a stroke, there is also an increase in the blood pressure. But the blood pressure reduces by itself during the first week. If the affected person is given antihypertensive drugs, the blood flow to the tissues will decrease, and as a result, the condition of the person will worsen. But among some people with a stroke, the increased blood pressure should be reduced slightly in order to protect the other internal organs from damage, which could occur because of the increased blood pressure. Due to these reasons, the usage or administration of antihypertensive medicines among the people with a brain infarct is controversial or complicated. I have already explained the treatment of a brain hemorrhage. Other than the administration of medicines like aminocaproic acid and tranexamic acid, the same treatment is done. Aminocaproic acid and tranexamic acid are not given because no thrombolysis was done, and this brain bleed is something that was already present in this affected person. Okay, treatment of brain bleed also involves transfusion of platelets and cryoprecipitate, the administration of prothrombinase complex, concentrate, vitamin K, and other things is also done. This treatment or this administration helps the damaged arteries to heal. People with brain hemorrhage also have an elevated blood pressure, which needs to be reduced so that the severity of the bleeding could be reduced. In the case of a subarachnoid hemorrhage, the antihypertensive medicine nimodipine is administered, and in the case of an intracerebral hemorrhage, nicardipine and or labetalol are administered. It is possible that the person with the brain hemorrhage could also have a seizure or an epileptic attack due to the bleeding. To prevent that or to treat that, the people with a brain bleed could be given anti-epileptic medicines such as levetiracetam. Because of the bleeding, there is an increased pressure within the skull or an increased intracranial pressure. Sometimes a surgery could be done to reduce the severe bleeding, and consequently this pressure in the skull also. And this could be achieved through craniotomy, decompressive craniectomy, and other surgical procedures. The damage of the blood-brain barrier is one of the reasons which causes this increase of pressure inside the skull. In both types of stroke, there is a damage to the blood-brain barrier, or there is a damage of the blood-brain barrier. As a result, there is an increase of fluid in the skull and or in the brain cells. There is also an increase of fluid around the damaged or dead parts of the brain. As a result, there is a swelling of the brain, and that could lead to a reduced blood supply, headaches, brain damage, or brain death. To reduce the amount of excess fluid and the pressure in the skull, mannitol is administered or given. Everything I've explained so far must be done as quickly or as fast as possible because it's an emergency. And because of the delays in treatment, the condition will worsen due to the lack of oxygen and due to the increase in the bleeding inside the brain. Then the question arises, if everything has to be done so quickly, is it really necessary to do a CT scan of the skull first? Can we not directly start the treatment right away? No, the confirmation of stroke and its type are critically important. Although the two types of stroke have almost the same symptoms, their treatment is completely different. As you can see, there are different goals. Among people with a brain infarct, the blood has to be diluted or thinned, and a free blood flow has to be achieved. But the people with brain hemorrhage are given medicines that promote or support the coagulation of blood or clotting of blood. Thinning of blood in a person with a brain hemorrhage would be catastrophic. In the same way, it would be catastrophic if we gave medicines that promote or support blood clotting to a person who has a brain infarct. That's why through a treatment without the confirmation of the underlying problems or underlying problem, we could create a condition in the affected person that is completely the opposite of normal or healthy. In people or among people with a brain infarct, a CT angiogram or MR angiogram could be done as an additional test or investigation to determine exactly where the narrowed artery or where the blocked artery is. These are the arteries of the brain that are frequently blocked, but the other arteries could also get blocked. Imaging procedures are usually done before the treatment is started. If a large infarct is visible on CT, then a CT angiogram or MR angiogram is necessary to determine where the vessels have been narrowed or blocked and what the state of the blood flow in these areas is like. In the presence of a large infarct, there is a high risk of bleeding if thrombolysis is done. A large infarct would look like this on a CT scan. Hopefully, the change is visible in this image. After the angiogram is done, and based on the results of the previously done investigations, the treating doctor could decide whether an invasive treatment such as angioplasty, thrombectomy, or other things can be done at the site of the blockage or the narrowing in order to expand the cavity or the interior of the narrowed or the blocked artery and finally restore the blood flow to the parts of the brain where there is an absence of nutrients, oxygen and other things. But that depends on the place of the infarct and the condition of the arteries. This invasive treatment should be done within 6 hours to 8 hours after the symptoms of a stroke began. It is done if the infarct occurred due to the blockage of a large artery and if the person is not suitable for a thrombolysis. This is a brief summary of the contraindications of thrombolysis and a little more. The investigation of CT perfusion is also important. CT perfusion is a scan done using a contrast agent. This scan allows doctors to determine the latest values of important tissue perfusion parameters such as cerebral blood flow or CBF, cerebral blood volume or CBV, mean transit time or MTT, and other things. After this scan, the doctor knows how much of the affected brain tissue can be saved, or which is called the penumbra, and the doctor would also know which parts of the brain have irreversibly died, which is called the infarct core. The results of this investigation help the doctor choose the right treatment method that could lead to the best possible improvement in that person. After a delay in treatment, or when conventional CT scans are not very helpful, or to rule out bleeding in the brain, and for a few other reasons, CT perfusion helps to gain clarity. If the person wakes up with the symptoms of a stroke, but the person was symptom free when the person went to sleep, then we will not be able to know how many hours ago the artery got blocked and triggered the brain infarct or led to the brain infarct. In such cases, CT perfusion is particularly helpful in choosing the right treatment. And in this case, Jerry is not guilty, hopefully. Okay, so this is an image of the screen of the device during CT perfusion investigation. Based on the values of these parameters, the doctor assesses the condition of the affected parts of the brain. Yeah, and based on that, an appropriate decision is made. CT perfusion is a long topic. One could learn more about CT perfusion on Wikipedia if interested, or this video could be helpful. This video is long, but it is helpful, or this video is smaller and the doctor explains it in fewer words. And in this video, the doctor also explains that for some people, after a delay in the treatment, the attempts to restore the blood supply may have no positive effect because the affected parts of the brain are irreversibly dead, or the affected part of the brain is irreversibly dead. If no improvement is achieved, or if no improvement is possible after the treatment, attempts are made to improve the quality of life of the affected people or the affected person, and that is done through rehabilitation and physiotherapy and other things. Such people could be treated with thrombolysis, but in such cases, after the delay of the treatment, the overall benefit would be low or almost nil, and the risk of bleeding would be high. Even a thrombectomy would be useless because the affected part of the brain has already died due to the delay in the treatment, which I explained earlier. Yeah, time is brain. But sometimes there are a few people who have a penumbra mismatch, although the symptoms started almost 24 hours ago. For them or among them, a thrombectomy could create something positive. The attempt is to restore blood supply to the affected parts of the brain as soon as possible, and as a result to allow oxygen and other nutrients to that affected part of the brain. If there is little or no time loss after the symptoms of a stroke began and before the treatment was started, then thrombolysis would be done. If treatment was delayed after the symptoms began, then CT perfusion could be performed to determine whether thrombolysis would be of any value at all, or whether some invasive measure such as thrombectomy should be the treatment method. Then one might ask, why thrombectomy? If despite the delay in treatment, restoring the blood supply were possible through thrombectomy, then why is it not possible through thrombolysis? Although the thrombolytic agent begins breaking down the blood clot immediately after the thrombolytic is administered, it takes up to 48 hours for the thrombolytic to completely dissolve the blood clot. If we were to treat the affected person through thrombolysis or with thrombolysis after a delay of the treatment, then we would delay the restoration or recreation of the blood supply even more. So there is already a delay, but that delay will be even prolonged. And as a result, the brain tissue will die irreversibly. For this reason, thrombolysis is not valuable after such a loss of time. But through thrombectomy, the consequences of a delayed thrombolysis could be avoided and the blood supply could be immediately restored. Then you may have some other questions. If thrombectomy is or would be more efficient in restoring the blood supply compared to thrombolysis, then why is thrombectomy not always chosen as the treatment method? I hope I am able to explain the following correctly. There are not only large arteries in the brain, but also several smaller arteries in the brain which could get blocked and result in a brain infarct. If the smaller arteries or smaller artery become blocked, it is not possible to slide in the tiny devices like the catheter and the other tools up to the site of the blockage or the narrowing to remove the blood clot or thrombus. Here thrombolysis would be helpful, but only if it is done as soon as possible. But a larger artery, when a larger artery is blocked in the brain, and if the treatment is done through thrombolysis, then there could be little or no positive effect. The reason of this little effect is the large size of the blood clot. A high risk of bleeding would also be present in such cases. Due to these reasons, the treatment of an occluded large artery or a blocked large artery should be done through thrombectomy as soon as possible. Otherwise, the affected part of the brain will irreversibly die. This is why neurologists and other doctors say time is brain. CT perfusion is done to determine the condition of the penumbra. Even if a normal CT scan of the skull reveals a small brain infarct, a CT perfusion scan could be done to determine whether the affected parts of the brain can be saved at all or how much of it can be saved. After this scan, the doctor would know whether thrombolysis, which has a risk of bleeding, could produce any positive results. However, CT perfusion is sometimes ineffective in showing the penumbra. Then the magnetic resonance alternative to CT perfusion, the PWI, DWI, MRI could be performed. This investigation is not done often despite its more accurate imaging because it takes longer than the CT alternative. Okay. Also, it is not available in all the hospitals. The total time of these investigations could be even longer than what I am showing you. The DWI MRI measures the movement of water molecules in the brain tissue. It is the best method for detecting and visualizing the infarct core, and the PWI MRI allows us to see the blood flow to the brain, and that helps us in identifying the parts of the brain which have a reduced blood flow or a reduced blood supply. A comparison between the two sequences could reveal a PWI-DWI mismatch. In a mismatch, the area of reduced perfusion is larger than the area of reduced diffusion. Okay. If one explains these procedures in a little more detailed way, one could say that DWI MRI and PWI MRI are performed one after the other. DWI MRI produces the ADC map and the diffusion restriction. Diffusion restriction shows the movement of water molecules in the brain and the absorption of water by the brain tissue. In this way, DWI MRI can be used to identify the parts of the brain that have irreversibly died. Like CT perfusion, the PWI MRI detects perfusion parameters such as cerebral blood flow, etc. And that allows us to identify parts of the brain that have reduced blood flow and that can still be saved. The results of both these investigations are assessed, and then the affected person receives the best possible treatment. These investigations are a bit more complicated than CT perfusion. Unfortunately, I couldn't find any websites that explain the precise usage of PWI, DWI, MRI to assess a brain infarct. But you could learn, or one could learn about the procedures of TWI MRI and PWI MRI on Wikipedia to understand how they are done and how they help. And some YouTube videos are also helpful, but the doctors explain the DWI MRI and PWI MRI procedures separately and not specifically about brain infarct. This video is already very long. Otherwise, I would have tried to explain these procedures in more detail. Sorry. Okay. So these perfusion investigations are done basically to find the penumbra. Compared to the other imaging techniques, the perfusion studies have the advantage of showing even the current or latest state of the brain tissue and making it visible of how well that brain tissue is functioning anatomically or physiologically. I mean, how well the area is functioning will also be shown through these perfusion investigations. Okay. And among people with damage of the kidneys, doctors try to perform these investigations very carefully. By kidney damage, I mean the presence of issues or illnesses in the person that cause the kidneys to be constantly damaged and which lead to an improper function of the kidneys. Since these imaging investigations such as CT angiogram and others are performed using contrast media, kidney damage is possible due to the cytotoxic effects of the contrast media. Therefore, a renal function test is necessary to know the status of the kidneys, at least after the contrast media guided investigation is done. If the renal function test could be done before and after this investigation, then that's also a good thing. If it is known that the affected person not only has a brain infarct but also has such kidney issues, then contrast agents that are less damaging to the kidneys are used to do this examination. Otherwise, contrast media induced kidney damage could occur, or contrast induced nephropathy could occur. Okay, in such cases, consultation with a nephrologist could be necessary, at least before getting discharged from the hospital. I mean, at least before the affected person gets discharged from the hospital. And in a similar way, lesser nephrotoxic contrast media could be used in the PWI MRI. And if I remember correctly, then the DWI MRI doesn't require any contrast media. Okay, another important thing is that we should not forget that these contrast media guided investigations are only then definitely necessary when a large brain infarct was made visible by the CT investigation and when the treatment is delayed or when we don't know about the starting time or beginning time of the symptoms. Okay. Other than these treatment methods, or other than these external treatments, the body itself tries to supply the affected area with blood, and this happens through the collateral circulation. But before I explain about that, I should show you something. Below the brain, it would look like this, or it looks like this, at least in 2D, okay, in 2 dimensions, in two-dimensional imaging, or the circle of arteries that is almost midway under the brain is called the circle of Willis. Okay, the arteries that originate here are largely responsible for supplying the brain with blood, oxygen, nutrients, etc. And this is an image, or a two-dimensional representation of the blood supply of the brain, or perhaps it is a diagram showing the position of the arteries that supply blood to the brain. If one of these arteries becomes blocked, then the surrounding arteries of the brain will help supply blood to the parts of the brain where there's a lack of oxygen, nutrients, etc. This blood supply is not enough, but it helps to improve the condition of the affected person. These alternative arteries are called collateral arteries or collateral vessels. This development of vessels, or this utilization of alternate collateral vessels, is called collateralization. There is also a formation of new arteries due to the blockage to supply blood to the affected part of the brain. This formation is called angiogenesis. Because of the collateral vessels, the risk of another stroke is slightly reduced. They supply the brain tissue with oxygen, and the recovery is somewhat supported. This is an image of a CT angiogram of a healthy brain where there is no brain infarct, and this is an image of a CT angiogram of a brain where there is a brain infarct due to the blockage of the middle cerebral artery, I think. In this area, no blood vessels are visible due to the blockage. You can compare this to the other side of the brain where the blood vessels are visible. But here some collateral vessels are visible. This could be due to either the formation of new brain arteries or due to the utilization of alternate arteries in the brain, or due to collateralization. These are some CT angiogram images of different people showing the formation of collateral arteries at different levels of their brains. But the number of collateral vessels is different, but the level of collateralization is different. Okay. It is also visible how the brain condition has changed among different people within 24 hours. The collateral arteries help in this way, at least among those who show lesser deterioration of the brain's condition. If there is good collateralization after a brain infarct, it helps with a faster recovery. But recovery depends on several factors. Despite that, collateralization helps. There are some factors that influence the development of collateral vessels. As you can see, giving certain medicines after a brain infarct will also be helpful. I'll explain that soon. You could learn about collateralization on the website of Cleveland Clinic if you would like to. There is also information about collateral circulation on Wikipedia. There are also some other conditions where the symptoms look exactly like the symptoms of a stroke, such as hyponatremia and hypomagnesemia. For some reasons, there is a deficiency of these electrolytes in the body. These are the normal blood levels of some important electrolytes. Before I explain in detail, I need to say something important. Because of the brain injury that occurs due to a brain infarct or a brain hemorrhage, there is a disruption of normal healthy activities in the body. As a result, there is an electrolyte imbalance which will trigger additional problems. That is why among people with a stroke, their blood levels of electrolytes are checked regularly and any imbalances are treated timely. Okay. Homeostasis is necessary in the body so that all activities and tasks run smoothly. Sometimes external support is necessary. I'll explain that soon. First, a little bit about the small cells that are a huge part of this video and of this issue. This is a drawing or a diagram of a nerve cell. The nerve cells are connected to one another in this way. Electrical signals are transmitted through these cells. Sodium is necessary or needed to transmit these signals through the nerves. Hopefully, this activity is visible to you. If there is less sodium in the blood, this activity does not happen sufficiently. As a result, the nerves do not function adequately and the muscles would not receive any stimulation. As a result, there is muscle weakness and other symptoms which are similar to the symptoms of a stroke. Calcium is also necessary for the muscle contraction, but magnesium impairs the effect of calcium or this effect of calcium. If there is too much magnesium in the blood, then there is no muscle contraction. There would also be no contraction of the heart muscle. That's why this condition is an emergency. If there is too little magnesium in the blood, then there is no impairment of the activity of calcium, and as a result of that, there is excess muscle contraction, which can lead to a condition of tetanus and also to arrhythmias or abnormal rhythms of the heart. Okay. In summary, it can be said that the symptoms of hyponatremia are similar to the symptoms of a brain infarct, and the symptoms of hypomagnesemia are similar to the symptoms of a brain hemorrhage. Okay. Therefore, such electrolyte abnormalities should be corrected as soon as possible if they occur. Brain infarct occurs due to ischemia or due to reduced or absent blood supply. Therefore, a brain infarct could also occur due to anemia or due to reduced amount of red blood cells in the blood or body. Okay, due to the shortage of red blood cells in the body, the brain cells cannot receive sufficient oxygen, and this can happen even among young people. Although people with anemia occasionally experience symptoms such as shortness of breath, rapid heartbeat, and other things, which are usually ignored, the signs of a stroke could one day appear in these people or among these people. As long as there is a proper or timely treatment after the beginning of such stroke symptoms among such people, the affected person's condition could improve. Anemia is treated by transfusions of packed cells, injections of erythropoietin, infusions of iron supplements such as iron sucrose, iron carboxymaltose, iron derisomaltose, etc. And these names in the parentheses or in the brackets are the brand names of these medications which are sold in India. I am sorry if I have made any mistakes in sharing with you the brand names correctly, but the medications are correct. And an important thing is that uh, to avoid such issues of anemia or to have a healthy count of red blood cells in the body and a healthy amount of hemoglobin in the body, one could also eat healthily if possible. Okay, spinach, beetroot, milk, yogurt, banana, eggs, all of those things which you see on the screen right now are very helpful in improving the blood counts of red blood cells and to improve the hemoglobin quantity in the blood. This is the result of an investigation of complete blood picture of mine, which was done a long time ago. Hopefully the results and the healthy limits are visible. Okay, so in addition to these tests of complete blood picture, further tests would be carried out which I have already explained in this video, and the appropriate treatment would be done based on the results of these tests. And we can also find out through a person's eyes whether the person has anemia. This is what the eyes of a person with anemia would look like. Very pale and pink colored. The arrow points to the part of the eye that is checked for pallor or for anemia. This part of the eye is the conjunctiva under the lower eyelid. Okay, and this is another sign of anemia, koilonychia or spoon nails, which is also a sign of iron deficiency anemia. There are a few other places on the body that can be checked for paleness or for anemia or for pallor, but the eyes can show us quite accurately whether the person has anemia. That's what I think. And if there is sufficient hemoglobin and if there are sufficient red blood cells in the body, the eyes of the person would look like this, or this is what normal healthy eyes would look like. I should return to the main topic. So after the person with the symptoms of a stroke is admitted in the hospital, their blood sugar levels are also regularly checked, and if there are any abnormalities of the blood sugar levels, then they are treated appropriately. Unfortunately, the people who have a stroke also have a reduction of immunity due to the changes which happen in their body, and due to that they have an increased chance of developing lung infections due to the paralysis or weakness of the muscles in the throat and the larynx or voice box. Affected people or the people with a stroke would aspirate or inhale food, liquids, and stomach contents instead of swallowing that food, instead of being able to swallow that food, and that would lead to lung infections. This is one of the reasons of death among people after a stroke. To prevent lung infections and to ensure that the patient receives adequate or sufficient nutrition, a feeding tube or nasogastric tube is inserted soon after the person arrives at the hospital, and the person or the patient receives nutrition through this tube. To prevent lung infections, patients are not allowed to take anything through the mouth. They're not even allowed to take water through the mouth. And this is called nil by mouth or NBM. Normally, a nasogastric tube is used as the feeding tube. So that tube is inserted through the nose. But in some cases, an insertion or placement of the feeding tube through the nose is not allowed to prevent worsening or to prevent further injuries. Okay. Then the same tube, the Ryle's tube or the nasogastric tube, can also be inserted through the mouth. Okay. It's just called a nasogastric tube because it's inserted through the nose into the stomach. Okay. But the actual name is Ryle's tube. Maybe there are also other tubes, but what I know is Ryle's tube or a feeding tube. Okay. And in case of an insertion through the mouth, in case if this tube is being inserted through the mouth, a protective device or a Gudel tube would then be first inserted into the mouth area so that the tube is not bitten or damaged. After this insertion, the nasogastric tube or orogastric tube is inserted through this opening, and the person will receive food such as porridge, juices, milk, buttermilk, protein powder, etc. through this tube, through this feeding tube. And that is done using a feeding syringe. Foods such as porridge or oatmeal and protein powder are first mixed with water so that they can be loaded or filled into a large syringe, and that is later on pushed in or injected through the feeding tube into the stomach of the person. Okay. And tablets such as aspirin that the person receives are crushed using a mortar and pestle. The powder is then mixed with sterile water and pumped through the feeding tube using a syringe into the stomach of the person. Other medicines are also given to the affected people in this way. And in India, at the hospitals I worked, the sisters used to take care of this. The sisters or the nurses used to take care of this task. Okay. And one should know that due to feeding through the feeding tube and because of swallowing difficulties of the person or that the person will have, it is a challenge for the person to obtain sufficient nutrients after a stroke, which leads to muscle wasting. Even due to reduced ability of the people to move, there is a muscle wasting. Okay, so as the person remains at the bed or in the bed for longer durations of time because of the weakness of muscles they have or due to the paralysis of muscles they have, there is muscle wasting. Additionally, the body needs more energy and more protein so that it can recover properly. For these reasons, protein powder is administered daily to the person. Okay, and since many affected people cannot move well, they would be bedridden most of the time. And if the person remains lying down for prolonged periods of time, then the chance of a lung infection increases even further. And as the person is bedridden, or as the person would be bedridden for most of the time, pressure ulcers or bed sores could develop on the back of the person or on that surface where there is more pressure. So, to prevent bed sores and to prevent lung infections and to rehabilitate the person, the affected person should move around regularly as much as possible. And if the affected person has difficulty walking around, then the person must either be moved around in a wheelchair daily, or the person must be accompanied by another person, and the person should walk around as often as possible. Okay. Air mattresses are also offered so that pressure ulcers or bed sores would not develop. And due to constant developments, there are different types of air mattresses that would be helpful to the affected people or for the affected people. And due to the pathological changes that happen in the brain, there is also an increase in the body temperature. Pro-inflammatory mediators are also released into the blood, which causes an increase in the body temperature. Infusion with ice-cold fluids could be advised or prescribed as treatment. Medicines to reduce fever are also prescribed, like for example paracetamol. Blankets, pillows, and other things are offered so that the person feels comfortable. But the treatment of an increased body temperature is done very carefully, because body temperature does not support recovery if the body is colder than 28 degrees centigrade. A very important aspect of treatment is physical therapy or physiotherapy. Every day a physiotherapist comes by to train and strengthen the muscles of the person. This is an important part of rehabilitation, which all the people need who have had a stroke. And if there is a pneumonia or a lung infection, just physiotherapy might be advised or might be prescribed. One type of chest physiotherapy involves clapping the person's back for a while so that the mucus in the lungs could separate from the walls of the lungs, or so that it is loosened. And after that, the person is motivated or requested not to suppress the cough and to spit out the mucus or the phlegm. Okay, and there are also even more exercises in chest physiotherapy. What I explained regarding the clapping on the back of the chest area is one of those exercises or one of those physiotherapies. And a container is also provided or offered so that the person doesn't have to constantly run to a sink to spit out the mucus. I experienced this at a hospital where I worked in India. Okay. Additionally, the person is given a spirometer, or the person is prescribed a spirometer with which the person must perform exercises at least 10 times per hour daily. And what you see on the screen right now is a volume oriented spirometer. It helps improve the lung function, and it helps to strengthen the muscles around the lungs that are necessary for breathing. Okay. One should know that the chances of death are higher when the patient's condition or the person's condition becomes so severe that the person requires artificial respiration. Therefore, as much physiotherapy as possible is done to the person, and the necessary treatment is done so that the patient or the person does not require the support of an artificial respiration device or a ventilator. Okay, if the patient has difficulty breathing, oxygen is supplied. First, it is done through nasal cannula or a nasal prongs or a breathing mask. And if this is not sufficient, then the person could be intubated. But first, the doctors try to improve the person's condition through nebulization. The mask you see on the screen is a special breathing mask, and it is helpful in the inhalation of medicines during the nebulization. The drugs used in or during nebulization are ipratropium bromide, levosalbutamol, budesonide, and other things. Okay. Inserting endotracheal tube is called intubation, and after the endotracheal tube is placed or inserted, the person's status is intubated. I mean, they say that the person is intubated after the tube is placed, and then the artificial ventilation happens through this tube. The insertion of this tube is complicated because the esophagus and the trachea, or the food pipe and the windpipe, are next to each other in the throat. Therefore, the endotracheal tube is inserted very carefully, and after this tube has been inserted, the doctor examines the he uses a stethoscope to check whether the tube is in the correct place. And this check or this verification is necessary because this endotracheal tube is sometimes incorrectly inserted into the food pipe instead of the windpipe. And that would worsen the condition of the person, and it could also lead to death, because when the endotracheal tube is in the food pipe, then the lungs would not receive any oxygen, right? So that's why this verification is very important. And this check is done after the endotracheal tube has been connected to at least an ambu bag. Okay, I mean, after the intubation, this check is done after the endotracheal tube has been connected to an ambu bag at least. Okay, and to prevent the endotracheal tube from being damaged or bitten, some means are used to protect it. But if the person has to remain intubated for a longer duration of time, consequences are to be expected. To avoid these problems or to avoid these consequences, a tracheostomy, which is a small surgical opening of the airway, could be done. And through this opening or through the tracheostoma, the person is artificially ventilated. Although tracheostomy has its own disadvantages, it offers something better compared to an endotracheal tube. After the condition of the person's lungs improves, they are slowly weaned off the ventilator, or they are slowly made to depend less on the ventilator. After that, the tube or the trach is removed, but the opening is not closed or sutured, because this opening or stoma closes up by itself over time, as you see. These are invasive types of artificial ventilation. There are also some types of non-invasive artificial ventilation, such as biphasic positive airway pressure or BiPAP and continuous positive airway pressure or CPAP. But one should know that among people with a stroke, there are also weak or improper reflexes. Because of that, the airways do not have sufficient protection. Among such people, there is also an excessive amount of secretions which are not properly managed by the body. Okay, for these reasons, there is an increased risk of lung infections, or there is an increased risk of worsening of the lung infections they already have. And because of that, invasive alternatives of artificial ventilation or respiration are preferred over these non-invasive alternatives. I can't add any more information about artificial ventilation of people with a stroke. I think I I don't think I'm sufficiently experienced to that. Okay, so okay. Another thing that is important to know is that due to the sudden worsening of the person's condition, that happens among the people with a stroke, they might feel very depressed and lose interest in life. As a result of that, they might no longer want to do anything such as participate in the physiotherapy and participate in other activities which would improve their condition and similar things. In such cases, appointments with a psychiatrist or a psychologist might be necessary and they would be helpful. Additional psychiatric medications could also be helpful to such people. Basically, doctors take care of the patient's A, B, C, D, E's. Once they present once the patient comes to the hospital with the symptoms of a stroke. So, airway, breathing, circulation, and more. This scale is also important for assessing the person, the NIH stroke scale. You can find more details about the parameters of the scale on this website. The link to the website is in the description of this video. It is also important to know that the time frame of improvement and the length of hospital stay varies among different people if affected. Among people with a brain infarct, the symptoms are slightly less worse and the recovery after a quick treatment is somehow faster compared to what is seen among the people with a brain hemorrhage. But recovery depends on several factors, as you can see. A person's discharged or an affected person's discharge from the hospital depends on their condition. For example, if they no longer require ventilation through a tracheostoma, or if they no longer require the support of a ventilator, and if their life is not at risk, and other factors such as an improvement in the maximum total score on the coma scale, on the Glasgow coma scale, and the decision of the attending physician and other things, or the decision of the treating doctor and other things. If there is improvement of condition but not completely, then some people would be discharged from the hospital without the removal of the Foley's catheter and the feeding tube. As you already know, such patients lack normal muscle strength, due to which there is a risk of inhaling foreign bodies and there is a loss of control over urination. The feeding tube and the catheter are helpful to that person at their place of stay. The discharge will take place only after the risks, complications, and other things have been thoroughly explained. One should know that the Foley's catheter has to be replaced with a new one once every 4 to 6 weeks, and that is done to prevent urinary tract infections. The use of a feeding tube or a nasogastric tube or any other such feeding tube is actually intended for less than 6 weeks. But if the patient needs to be nourished long term through a feeding tube due to weakness of muscles or due to the paralysis they have, then the option of nourishment through a gastrostomy tube or a gastrostomy eunostomy tube or a eunostomy tube could be considered. I'm sorry that I couldn't find any pictures of adults in this regard. Okay. So if there is little improvement or if this improvement could be increased through rehabilitation, then the person is shifted to a rehabilitation clinic. Again, this is the decision of the treating doctor. Physiotherapy and other additional therapies may be necessary in the long term, but this depends on the person's condition. Unfortunately, as they are still admitted at the hospital, some people do not follow the recommendations and instructions of their treating doctors. They take food or liquids by mouth and they get lung infections after that. After that, their condition worsens and they face difficulties. So, unfortunately, some of these people don't get through or they don't survive. Okay. So, after hearing all of this, anyone would have a common question: how can we prevent a stroke? One could eat healthy food or one could eat in a healthy way. Salt intake should be under control. Giving up alcohol would be helpful. Regular exercise is also helpful. And one could meditate to reduce the stress one has. Although it is not taken seriously, one could really avoid smoking. Okay. And if certain factors can be influenced or controlled, then a stroke can be permanently prevented and one could live a healthy life in the long term. When blood pressure, blood glucose, and blood cholesterol lie within the healthy limits, and when the person has a healthy habits or healthy lifestyle, like no intake or no usage of tobacco, then the person would live a healthy life in the long term. However, there are some exceptions. There are some people who have genetic conditions such as Ehlers-Danlos syndrome, Marfan syndrome, and other things. Such people could develop aneurysms even though they lead a healthy lifestyle and take their medication regularly. And if an aneurysm develops in the brain and if it ruptures, then you already know what happens. Even some preterm babies could develop brain bleeds or brain hemorrhage because that happens because the blood vessels in the brain of such preterm babies are not fully developed. So the blood vessels in these brains are not fully developed, and that's why the skull or the head of the preterm babies is examined or investigated through ultrasound frequently after those babies are born, and this investigation is not done through CT or MRI. And if there is any brain bleed among preterm babies, then there is a symptomatic treatment. I mean, the treatment is done to improve the condition of that baby. There is no specific treatment to stop this bleeding, I believe. As I am not a neonatologist, I cannot explain regarding this in detail. But I read that the treatment is done to improve the vital signs of the preterm baby. For example, the blood pressure, the oxygen saturations, the pulse rate, and other things. The treatment is done to improve them, is what I read. Okay. So now a few other exceptions. If the affected person lives far away from a hospital where imaging procedures such as CT or MRI are not possible or available after the beginning of the symptoms of a stroke, then there is a possibility of shifting the affected person to a higher center through an air ambulance, and this is provided by ICATT, or International Critical Care Air Transfer Team. Or such a transport could happen with the help of GoAid or air charter services. GoAid offers various types of transport, or one could try this through fly air charters. Even so, hospitals like Yashoda hospitals and others have the feature of air ambulances. Their contact details, or the contact details of most places, are made visible, which I found on their websites. But I request you to confirm their contact details by yourself in case you ever require their services. And then comes a question, what if neither a confirmation of the underlying issue is possible through an imaging technique like CT or MRI, nor is a transport to a higher center possible? What to do then? Then one may think of examining the throat and the skull or the head of the person through ultrasound investigation to confirm the underlying issue, or to confirm the problem, what is causing the issue. Uh, Please listen to this a little more attentively if possible. The internal carotid artery supplies blood to the brain, and a part of the internal carotid artery is in the neck. Approximately 15% of the cases of a brain infarct occur due to the blockage of the internal carotid artery. In these brain infarcts, the affected area lies in the area which is supplied by large arteries of the brain, or these brain infarcts have a bigger infarct core, or there is a bigger infarct core in the person who has these brain infarcts. I hope I explained that properly. Okay, so although a visualization of such an issue may be possible through ultrasound of the neck, the possibility of a brain bleed cannot be excluded because the bones of the skull are fully developed among adults, and these bones don't allow the ultrasound waves to visualize the deeper structures of the brain. In order to do thrombolysis, it is crucial to confirm the absence of a brain bleed. You already know about the creation of a much worse condition if any treatment is done without the confirmation of an underlying condition. This is why, in case of absence of imaging procedures after the begin or onset of the symptoms of a stroke, the doctors treat the person symptomatically, partially at least, and then they work on sending the affected person to an equipped or developed hospital as soon as possible. And that is done so that the appropriate treatment can be done as soon as possible. And this has to be done as soon as possible because the more the treatment is delayed, the more the affected brain cells die irreversibly. Because of the reasons I mentioned, the ultrasound investigation of the throat area and of the head is not recognized to detect the underlying problems of a stroke. Due to the stroke, there is a disruption of the blood-brain barrier, and after the blocked artery in the brain is unblocked, in some affected individuals, there is a different metabolic state in the affected part of the brain and in the affected artery in the brain. In this metabolic state, the amount of reactive oxygen species increases. There is also a release of inflammatory mediators as a reaction to the brain injury. Here the brain infarct is the brain injury. The changes that happen after the affected cerebral artery is unblocked sometimes lead to damage to the affected brain tissue, and this is called reperfusion injury due to the increased amount of reactive oxygen species, due to the inflammatory mediators, and due to other processes. Further deteriorating changes occur, which could lead to a vascular destabilization and to bleeding. And this type of a change, where a brain infarct turns into a brain bleed or a brain hemorrhage, is called hemorrhagic transformation. Okay, these are the risk factors due to which a hemorrhagic transformation could happen. Normally, hemorrhagic transformation happens or it might happen after the treatment, but if the affected person has not been treated, then there is a prolonged absence of oxygen in the affected area. As a result, the blood-brain barrier becomes increasingly disrupted, and that leads to an accumulation of cytotoxic fluid and increased permeability of the affected blood vessels or the affected artery. Okay, cytotoxic fluid is the fluid that kills the cells, or it causes damage to the cells. And due to these changes, if the blood supply to such areas is even minimally restored, for example, by the backwards flow of blood through the collateral vessels into the affected artery, then the risk of extravasation of blood into the brain tissue increases. Then the blood just flows out of the artery into the brain tissue. Okay, so that's the bleeding. And hemorrhagic transformation could occur in 10 to 15% of the people with a brain infarct. After thrombolysis, up to 6% of these people with a brain infarct experience a worsening of the symptoms which they already have. Around 0.6% to 3% of the people with a brain infarct may experience a worsening of their symptoms even if they do not receive any treatment. Okay. Unfortunately, in some individuals, we can only confirm or observe hemorrhagic transformation through imaging techniques because they do not show or they do not have any signs of any deterioration of their condition. After the confirmation of a hemorrhagic transformation, the appropriate treatment is done. I cannot explain it in any more in detail as I am not a neurologist, sorry. But I should let you know that in some other diseases or conditions, there is a development of symptoms that are similar to the symptoms of a stroke. For this reason, they are ruled out or excluded after the presence of a stroke has been ruled out or after it has been confirmed that there is no stroke. In most of these diseases or conditions, these symptoms develop slowly or very slowly. But in the case of a stroke, in the case of abnormal blood sugar levels, or in the case of an imbalance of electrolytes in the blood, the symptoms appear suddenly. That's why imbalance of blood sugar levels and imbalance of electrolytes in the blood should be ruled out as the first step as soon as possible after such a person arrives at the hospital. Okay, many people don't know that a stroke could occur even after procedures such as angiography or angioplasty. These three factors described by the German pathologist Rudolf Virchow are responsible for this. I mean, maybe he didn't exactly describe them, but he has done a lot of research in this field. Due to his work, these factors were named after him. Because of the presence of the stent in the blood vessels after stent implantation, the blood flow and the turbulence of the blood change. Okay, and because of factors such as a tendency of faster blood coagulation in the person, new blood clots form rapidly on the side, and these blood clots are transported by the blood flow and they block an artery in the brain or in other places. And the increased blood coagulation could be either congenital, which means the person has it already, or it could be acquired, means the person could develop that issue. Okay, during the therapeutic procedures such as angioplasty or during diagnostic procedures such as angiography, one or more deposits of uh, cholesterol or calcium or other things are released or freed from the inner walls of the atherosclerotic artery, or blood clots form, and these are carried by the blood flow or by the blood to another location, and at the other location they block an artery and then the symptoms occur. The following is a little different and important. Please be a little more patient with me if possible. Normally, the possible risks which could happen during and after the procedure, the alternative treatments, the duration of the procedure, and other details are explained before the procedure. But sometimes the risks are not explained in detail. According to my experience in Germany, all the information about the possible risks, the course of the investigation, the alternatives, and many other things are explained in detail in the information sheets, which people have to read thoroughly before each procedure, and they have to sign to approve the procedure. And these papers are called Aufklärungsbogen. For example, this is the information sheet or the Aufklärungsbogen of an X-ray investigation, and this is that of a stress ECG or a treadmill test. This is that of a bronchoscopy, I think. Yeah, and this is that of a bone marrow biopsy, of an intravenous pyelography. Even simple non-dangerous investigations like ultrasound or sonography are explained in detail, and the procedure is done only after the patient's approval. Normally, the patient has to approve the procedure, but if the patient is not in a condition to approve or to accept the procedure, then the legal guardian of the patient can do this, as it is visible here. You could take a screenshot of this and use Google Translate for a better understanding. Okay, gesetzlicher Vertreter means legal representative or replacement person. So signature of the patient or of the legal replacement person is necessary, and if the patient is a minor, then the patient's parents approve the procedure, as it is visible here. Unfortunately, at many hospitals in India, such signatures are such signatures or approvals are obtained only for investigations of something like HIV blood test, or approvals are obtained on informed consent forms in serious cases before some investigations, and as do not resuscitate forms. Maybe in some Indian hospitals there are proper and thorough information sheets, but not in most. This is not to insult anyone, it is only to show or point out something where we could improve our healthcare system. Even before procedures like angiography, approval is taken from the patients or their legal guardians before the procedure can be done in Germany. The risk of a stroke is also explained here. Schlaganfall means stroke. It would be great if such Aufklärungsbogen are available in India at all hospitals. It would be amazing, right? Okay, so regarding the blockage of arteries after such procedures, I would like to share an experience with you. A 60-year-old family friend of mine suffered a stroke about 23 months ago or 22 months ago. Okay, actually, he has a coronary artery disease, or even specifically speaking, a triple vessel disease in which three coronary arteries are narrowed. He was treated with stent implantation for this. This surgery was performed in mid January of 2024, and at the end of February, he had a stroke. Fortunately, it was a minor lacunar stroke, or it was a stroke with a small lacunar infarcts. He had no muscle weakness and no symptoms like slurring of speech or other things. And basically, what he did was he did not neglect his symptoms at all, although they were very less or few symptoms. And his neurologist determined that this stroke occurred due to cardioembolic causes which were triggered by the previous surgical procedure of stent implantation. Okay, and he got the treatment, and he has no long term symptoms right now because he did not neglect his few symptoms at all. Okay, and regarding the treatment, I would like to add something. Since he was already taking antiplatelet drugs after his surgery of stent implantation, he did not undergo thrombolysis due to the risk of bleeding. However, he received the injections of a drug called sovatel. And after his discharge, he told me that he initially had symptoms of light confusion and balance problems. He also said that he knew that something was not right and that he has to go to the hospital. But he did not experience any muscle weakness or any paralysis of muscles or limbs. Okay. Treatment through endovascular alternatives would not have been possible for him because this was a lacunar infarct which occurs due to the obstruction of some smaller, deeper artery or arteries in the brain. So his neurologist decided to use sovatel for the treatment. And now this family friend of mine is doing better and he is working, so he is fit. I would like to explain some more about sovatel. Apoptosis means cell death. Because of the abnormal pathological changes that happen in the brain after a stroke, the affected brain cells slowly die. Sorbitol suppresses apoptotic changes in the brain, or it suppresses apoptosis of the cells in the brain, and it stimulates the neural progenitor cells, and that promotes the formation of new nerve cells and new arteries. Okay, following that, the patient's condition improves after they are given Sorbitol. In a similar way, my family friend's condition also improved. Along with Sorbitol, this family friend of mine also got the regular medicines like aspirin, clopidogrel, and other things which are used to treat the people with a stroke. But no thrombolysis was done due to the risk of bleeding. Okay, and I should explain that sometimes some affected people experience slower improvement in their condition. When that happens, the treating doctor could suspect if the affected people or the affected person or their bodies have developed a resistance to clopidogrel or resistance of clopidogrel. By that I mean that there is little effect or no effect after taking clopidogrel. And if the treating doctor suspects something like that, it is first checked and confirmed by blood investigation. CYP2C19 is a gene which is responsible for converting the antiplatelet medicines such as clopidogrel into their active state. After such a resistance is confirmed, stronger medicines such as ticagrelor or prasugrel are administered. But until the results of these tests are available, clopidogrel is continued or clopidogrel is given. Ticagrelor and prasugrel are very powerful medicines when compared to clopidogrel, but they are associated with a higher risk of bleeding. That is why they are not regularly prescribed. And unfortunately, some people's condition does not improve even though the necessary treatment was done and the blocked artery was unblocked or reopened. And this condition or this situation is called a futile recanalization. This happens for several reasons which you can see on the screen right now. If something like this happens, then there is no specific treatment. What neurologists then do is they try to improve the quality of life of such people, which is achieved through physiotherapy and other measures at a rehabilitation clinic. And despite successful treatment after a brain infarct, or even though the blood flow was restored, these patients have a 12% risk of developing a new blood clot or having an artery blocked in the future. But lifestyle changes and regular intake of their necessary medicines could help prevent such incidents. Sometimes there are fewer symptoms that people don't take seriously or which the people neglect. For example, slurred speech and a slight muscle weakness on one half of the body, confusion, etc. And this neglect could lead to long-term problems such as long-term weakness or permanent weakness or long-term paralysis of their limbs or other issues, maybe even death. One should know that just minutes after an artery in the brain is blocked, or just minutes after a bleeding starts in the brain, the affected part of the brain starts to die. In fact, the longer the underlying problems are not treated, the more the affected person's condition worsens. That is why doctors say time is brain. I am very sorry for repeatedly stating that time is brain, but it is very important that the person recognizes the signs or symptoms of a stroke and gets the proper treatment as soon as possible or as quickly as possible if these symptoms start in that person. I think the public and everyone else should be informed about the signs or symptoms of a stroke, like fast and be fast or be fast, for example. But that is not done. It is not very smart that only medical professionals would know about something like fast and be fast or what they stand for. Okay, that's why uh, I request you to pass on this information to the others if possible, what fast and be fast mean, and what a person should do if the signs or symptoms of a stroke start. Okay, uh, it is something that people would easily remember, I believe. According to a news article from the year 2025, about 18 lakh people in India get a stroke every year. Okay, according to another news article from the year 2021, due to stroke and its complications, around 7 lakh people passed away in India during the year 2019. Okay, that's why I request you to pass on this information fast and be fast and what they mean to the people you know at least. Okay, both types of stroke, I mean a brain infarct and a brain bleed or a brain hemorrhage, could be prevented, but if they occur, it will be very helpful if the treatment is done as soon as possible. I wanted to show you something else. During the video, I explained to you about chest physiotherapy. During one type of chest physiotherapy, the hand is made this way by the physiotherapist and the back is clapped in this way. Okay, in this part that is done, in this part. Okay, on the back, all over the back for some time. In this part, in the chest area on the back, I hope you are understanding me. So this clapping will be helpful in loosening up the mucus in the lungs, which could be later coughed out. Okay, and this is the current status of the scar of tracheostomy, which was done about 8 years ago after my motorbike accident, so that I could breathe artificially. This is how it heals. Even though I have explained a lot, there is definitely a lot more that one could know regarding a stroke. As you already know, medicine is an ocean. There is also unclear information about combined usage of thrombolysis and thrombectomy to treat a person with a brain infarct. But I am not experienced enough to state or explain anything regarding that. Okay. Also, there are many other parameters which are necessary to assess the condition of the brain, and there are more rules, or there is more information about how procedures like intubation are supposed to be done. But I'm not yet medical expert to explain about them confidently. I'm sorry. But if I missed explaining about something which is less complicated but very important, then please forgive me. Okay. I should let you know that in India, I met some people who are disabled since a long time, at least partially, because they never tried to get treated after the symptoms of a stroke began in them. That is why I request you to not neglect the signs or the symptoms of a stroke. If you or someone you know ever have these symptoms. These symptoms could also occur due to the imbalance of electrolytes or due to the imbalance of sugars in the blood or blood sugar levels. But these imbalances of blood sugar levels and of electrolytes in the blood don't cause permanent disabilities usually. But if these symptoms are due to a brain infarct or due to a brain bleed, then one could expect permanent or long-term disabilities or long-term issues. I I know how it feels when we are forced to depend on someone else, even for the smallest activities. You know, that's not a good feeling. I'm speaking from my own experience. It would severely damage a person's confidence and mental state if they were forced to depend on someone to even empty the urinary bladder or to urinate. Yeah, it's not a good feeling. Okay. I felt like explaining something else. Um, please don't get mad at me for this if possible. I heard many people using confusing terms regarding these conditions. As much as I know, stroke is a condition or issue that is related to the brain. People also say heart stroke, but there is heart attack. Yeah, but no heart stroke as much as I know. So there is heart attack and there is stroke. So there is no heart stroke. Just wanted to let you know. And something stupid. Some months ago, I made another video, but in that video, I used images which had printed out like this during the video, and I also printed out the medicines and showed them like this during the video, but that video was not very clear or satisfactory. Okay, but I hope everything I showed and explained in this video was easy to understand. Yeah. What you have seen so far, what you have heard so far was a lot of work. I had to spend numerous hours to prepare these images and this material. Due to my current unemployed status, I couldn't prepare a better video. I'm sorry. I mean, I could have prepared better videos using some better expensive equipment. I couldn't do that. I'm sorry. And regarding the sound, some of these some parts of the video were having a higher volume and some had a lower volume. I have not yet modified that. I have not yet tried to improve that part or those parts, but I'm sorry if I'm unable to do that when I'm trying to join the parts of this video. Okay. My only request to you is that if possible, uh, please don't bully me due to these issues in the video if possible. Okay. I would like to upload another video, or I would like to make another video on another illness of the cardiovascular system. I want to do that soon, as this video already has too many things, or since this video is too long, I couldn't add more information to this video. After I have uploaded that other video, Please watch that also if possible. I hope I'm able to upload it soon. And thank you very much for watching this video. Thank you very much. Really, that's a lot actually. Okay, please try to live healthy, and please, I request you, please don't neglect these symptoms if these suddenly develop in you or in someone you know. Okay, please don't neglect them. Okay, yeah, that's pretty much it. I hope this works out. Yeah, I wanted to say something else. This video is not to show myself as better or greater than anyone else. My since about 9 years, my life is in it has been in a standstill kind of thing. I'm just trying to do something. I mean, this is just an attempt to help make some progress in life. That's all. I hope this video helps at least one person. If I said anything in the video that's offensive, then I'm very sorry. Okay, that's all for now. Okay, please try and live healthily. Please take care of yourself. All the best. Till next time.